Tell you how to take better care of yourself, and if you're a man, how to tell you to take better care of the women in your life. We're joined by Dr. Manish Singhal. He's with us from Apollo Hospitals to discuss the importance of proactive prevention, early detection, and all of the latest advancements in breast cancer treatment. Doctor, thank you so much for joining us this morning on the show. Doctor, start our audiences off by first telling us, where do we stand as a country when it comes to breast cancer numbers? Are we seeing an increase over the years? Are we seeing a decrease? Are there certain states that see higher rates? Tell us first a little bit about the data, then we'll ask you for more specific, helpful tips.
If I were to speak on numbers, the numbers are worrying. We are definitely having an increase in the breast cancer incidence, and this is what we are seeing, what has happened in the developed world to now in the developing world. So as the countries they start developing, the breast cancer incidence is rising, and I think it's all related to our lifestyle and what we do in our lives and how we have been, the reproductivity rate and everything else is contributing to this rise in breast cancer. And we are also seeing that this incidence is higher in the urban states as compared to the rural areas.
Dr. Singhal, just tell our audiences, are we also seeing a certain demographic be more susceptible to this? And by demographic, I mean age group, for example. Tell us that, and what kind of woman should be particularly aware? So what I mean is, at what age in your life should you be conducting tests regularly? How regular do those tests need to be? Tell us.
So I think this is a very important question. We see India as such sees the cancer incidence being almost a decade earlier as compared to the Western population. So we are seeing more younger women with breast cancer, and this is true for all cancer types, not only breast cancer but all cancer types. And as far as breast cancer is concerned, I think the foremost for a resource constrained country like ours is self-breast examination. We have to promote self-breast examination for all women starting from the age of 25 years, immediately after the menstrual cycle is over. That's the exact time when a breast self-examination should be done.
I want to ask you, doctor, when you're conducting that self-examination, question one, how can our audiences who are watching right now learn how to correctly conduct it? B, what should they be looking for? I know we've heard a lot about the fact that you should be looking for a lump, but what would that lump feel like? Tell us that, and also tell us things like shooting pains. Are they also a sign of worry?
Yeah, so this is very common. Shooting pains are very common in young women, and this is all because of hormonal changes, and most of the time they are not worrying, right? But a self-breast examination, I think there are a lot of YouTube videos which one can see, but a very common mistake that people do while doing self-breast examination is they press the breast. You don't have to press the breast, you have to actually press it against the chest wall and rotate your fingers around the chest wall, press the breast against the chest wall, and then that is the time when you have to feel for a lump. But if you press the breast as such, then all breasts will have some lump. You'll have a lumpy feeling. So I think that's very important. It's also important to look at the skin. Is there any dimpling in the skin, any change in the characteristics of the nipple areola complex, and also feel for the axilla, the armpit. Sometimes breast lumps can appear in the armpit first and then in the breast later on. So a complete examination of the breast is important. It is important to look in, stand in front of the mirror, look at the size of the breast, any change in the size of the breast, any discharge from the nipple. So all these are very important points, and in case there is something worrying, it is important to go and seek the advice of a medical practitioner if you have any doubt, and then the rightful investigation can be done at that time.
Doctor, tell us, what about the bras that you wear? I'm asking because we talked a little bit earlier about lifestyle choices. You know, some even say the deodorant you cause can cause cancer. Today, there's a lot of fear about a lot of things causing it. Where are the lifestyle choices, that you say, this is how you should do it, this is how you shouldn't? What are your thoughts on the kind of bra, for example?
So there is no evidence in literature that the kind of undergarment that you wear would lead on to any cancer or anything. Similarly, the use of deodorants, I think these are all WhatsApp hypes or social media hypes which are created to attract attention. So there's nothing of that sort. I think what is more important is being hidden, if I can say that. And that is your lifestyle, how you live and what you do.
Okay, and I want to ask you, we talked about women, men. Tell us about that in this context. They often get left out of this discussion.
Yeah, so the incidence of men breast cancer is 1% of the total breast cancer that we see. So it's very rare for a man to have a breast cancer. Yet there are about some men. Recently, I had one man who was diagnosed with breast cancer. So, but for men, I think again it's about lifestyle and it's about more like prostate cancers. You show the red ribbon or the pink ribbon for the breast. Is a blue ribbon for prostate cancer. But that usually happens after the age of 45 years and in later life. So I think otherwise all cancer types, I think we all need to be very sure of our health and how we live.
Can we ask you, doctor, I hear so many families talk about this and they say, you know, हमारे परिवार में कैंसर की हिस्ट्री तो है ही नहीं, तो हमें डरने की कोई बात ही नहीं है. And I hear people say this again and again in their 50s and their 60s. You'll have someone saying, go take a test, and someone replying by saying, we just don't have a history of cancer. We don't need to be aware. Tell us, what is the connection there? How strong is that connection? If your family has cancer, you should get checked, versus if you don't have cancer, still get checked, you know?
Yeah, I think that's very important. We all are at risk. It's not that I am not at risk or anybody is not at risk. The average lifetime risk of having breast cancer is about 8% for a woman, whether family history is there or not. But if you have a family history, then your risk is much, much higher. And it's not just about having a family history, it's also about doing genetic test, which is now available. They are quite cheap, they are not very expensive, and you can actually gauge your risk. Depending on which gene is involved, the risk can be higher for some women and risk can be slightly lower for some women. So family history is important. It definitely puts you at a higher risk of having breast cancer, but otherwise the average risk remains for everybody.
Okay, doctor, before we move ahead, I just want to very quickly summarize what you've said, because some of this is so important and we need our audiences to take it home too. Firstly, you said conduct tests on yourself regularly if you can. You said young women need to be as aware as older women. There's no age barrier in this. But you also very importantly said, please, family history pe dhyan to de, but beyond a point, even if you don't have a family history, check yourself. Earlier though, doctor, what you also told us is that India is seeing rising rates unlike ever before of breast cancer. Doctor, tell our audiences, when you see women who are in that middle-aged age group, is breast cancer the single biggest killer? What are the other killers? Tell our audiences a little bit more, because, you know, medical sciences say, a lot of studies say this is an underserved age group, the postmenopausal women in particular.
So the top 5 cancers, if I were to say, in the Delhi Cancer Registry is, of course, the breast is the topmost among women. Then comes the cervix and the uterus. Then comes ovarian cancer, and then every other cancer. So I think the female cancers or female genitalia tract cancers and the breast cancer is among the top 5 cancers that women in Delhi Cancer Registry face.
Okay, and doctor, lastly, before we let you go, I just want to ask you, you know, earlier you were showing our audiences how to conduct an examination on themselves. And you told us, for example, that you need to press the breast back against the body and only then look for lumps. Am I summarizing that correctly? Just tell that to our audiences once more.
That's
because
very correct.
If they take anything home, it's really this that we hope that they take. Is it fair that we ask you to display that again once?
So it is about, you know, pressing the breast against the chest wall, and then rotating your fingers in a circular motion, and then coming closer to the nipple areola complex in a circular fashion, and then going to the armpit and feeling for the lumps.
Are you feeling for pain? Are you feeling for lumps?
Lumps. So a serious lump is a lump which is hard, a stony hard, if I may say so. Stony hard to feel. Otherwise, every breast will have some lumps. So all lumps are not serious lumps.
And that's really where, doctor, I want to ask you, you know, I've seen this happen before when people conduct tests. They feel like a knot is a lump. What does a lump feel like? How does it feel different from a knot? How can our audiences identify?
So I think if you were to just imagine in your brain, because till the time you feel for it, you'll never know. We can know because we feel for it. But it's, imagine that if under some cushion you are keeping a stone versus a very soft ball. I think that is the difference. So if it is very hard to feel, then it is definitely something which is serious.
So like a pebble instead of a small ball or something that is soft.
Yes.
Doctor, this has been so informative. To all of our audiences, if you're sitting at home, conduct it on yourself right now. See if you can feel something. And again, get regular screenings as much as possible. All right, we hope that you, our audiences of The Breakfast Club, felt like this was an informative note to end our show on. We are bang in the middle of Diwali week. Don't worry, we are going to keep bringing you Diwali stories. But this was a particularly important story we wanted to take the time out to discuss. Thank you for watching once again and have a beautiful day.